I think that we need to maintain vigilance and pay attention to this.
Talk of COVID brings up both bad memories and emotions, but the virus is surging again.
There's definitely an increase in cases in North Texas, and it's actually following a national trend.
Dr. Mark Casanova at Baylor Scott and White says there's cause for precautions, but not alarm.
The behavior of this strain seems to be on par with the various Omicron strains we've seen. We're not seeing individuals get particularly more sick than before.
Nationwide, hospitalizations are up about 20% in the last month. In Texas, they're up more than 70%. And in the Metroplex, there's been a 140% rise in the last 6 weeks.
We're not where we were before, but it's just we're still monitoring it and trying to see where to go from here.
Dallas County Health Director Dr. Phil Wong points out we are still far, far below COVID peaks. Hospitals are prepared, and there are already treatments. With few people testing, they're using wastewater to gauge the virus's rise.
People who are at high risk should try to do everything they can always to be protecting themselves.
There's been a pattern of summer travel surges and school year starts.
This is a very transmissible virus, and I think that's always been important to remember.
Wong and Casanova both say anyone positive or feeling sick should stay home. People with weak immune systems should probably mask, and a new booster expected in just a few weeks could help all of us.
Masks still work, and vaccines save lives.
In Dallas, I'm William Joy.
William is live in studio now. He covered COVID in North Texas from the very beginning. William, when we talk about another booster, as you just mentioned in your story, it kind of makes everybody wonder, is this going to be something that we need to take seasonally every year, kind of like a flu shot?
Yeah, early on in the pandemic, Teresa, we heard a lot of medical experts and researchers say this could end up being a lot like the flu, where it's simply always around. And Casanova told me it's still too soon to know if we'll end up getting yearly COVID shots the same way we do with the flu, because we're still learning more about it every day. But if your last exposure was a couple years ago, any protection that you had is probably long gone by now, Teresa.